Hello, welcome to Ray-ality TV. I'm Raymond Bakari, and today I'm joined by Dr. Daniel Muñoz, who is running for Governor of Rhode Island in the 2022 gubernatorial election. Dr. Muñoz, how are you today?
I'm well. How are you?
I'm doing great, and thank you for coming on. It's a pleasure of mine to have you on the show. Just diving right into it here, you are running in the 2022 Democratic primary for governor. What made you want to run for governor?
I mean, a lot of things made me want to run. Just in general, let me describe a 60-second bit on my life just to provide some context. I grew up in Central Falls, went through the Central Falls school system, then studied at Rhode Island College, lived in Providence for some time during college student, as well as Pawtucket, and transitioned from Rhode Island College after completing a major in philosophy and some concentration in pre-med to the University of Connecticut School of Medicine, where I studied medicine and received my doctoral degree. That personal journey for me has had many inflection points, and on one hand, understanding as a result of my lived experience, what this economic struggle feels like, what it feels like to go hungry, what it feels like to see a loved one suffering from addiction. And much of that likely pushed me to medical school and wanting to address that suffering and struggle using resources in healthcare. But entering into the healthcare industry, I realized that these systems, just like our education systems, are designed in ways where they ultimately set up barriers to access. And those barriers oftentimes impact historically disenfranchised communities that, with high prevalence, are communities of color. And so it's that journey through, again, Central Falls and my kind of urban core upbringing, and through medicine and then business after that, that I came to the conclusion that if we wanted to catalyze progress in a way that would result in programmatic change and transformation of our education and healthcare institutions, then it would have to happen through public service. And over the past year and a half, I have teamed both community advocacy and organizing with industry support, I would say, in terms of work, supporting contact tracing efforts, as well as vaccination system deployment, and then simultaneously serving on the state's Equity Council, where I have been fighting along with other community leaders for reducing and dismantling barriers to access for testing as well as vaccinations. And we're still doing that work now. So that's a long answer, but it's essential for me, for everyone listening, to understand that that's the experience that my values manifest from. And those values are the values that have informed my decision to run for governor, because it's not only about this crisis, which is still very much a healthcare crisis that we're in, the looming economic crisis that will follow, but also, what that means for communities that have already existed under the threat of gentrification, under the threat of eviction, and frankly, in an environment here in Rhode Island that is unsustainable in terms of cost of living.
And this is actually going to be your second bid for governor. You had ran previously in the 2018 general election as an independent and ended up placing fifth. Are there any key differences you see from that campaign compared to this one?
Yeah, absolutely. I ran as an independent previously, not because my values were different, not because the vision was different or the process of allowing community to inform the decisions that we make, but I ran as an independent because we have a history in Rhode Island of politicians that run under the Democratic Party and are either very much Republican in terms of kind of austerity measures that they would like to put in place and reducing, again, access to resources for vulnerable communities, but also just generally how they operate in terms of, manipulating and gaming the system in a way that I think sets up barriers for people that are coming from disadvantaged backgrounds to run for office. And I can name some examples like nomination signature collection, which is not a norm across the country that we still have here in Rhode Island, which is one of those barriers. So that's a long answer to say I ran as an independent in reaction to that corruption and that mode of operating. But what I did realize in running as an independent is that not only was it an additional barrier in front of the barriers that already exist, it was refreshing to have to explain policy positions. So that was a positive. But ultimately, when I looked out into the field of great work that organizations were doing, whether they were 501c3s, nonprofits, or 501c4s, more politically active nonprofit organizations, there, for me, it became, as an outsider to everyone at that moment, it became clear that if we want to see progress, then the systems we design and the organizations we design shouldn't use the hierarchical template that our political system has, because ultimately, if we're playing by the same exact rules, nothing will change. And so this time, I will say, after 2018, having been excluded from debates, having gone through some of those elements of running while other third-party white privileged male were let into the debate, it was a bit of a spiritual journey back. I was disheartened. I wanted to believe that we could affect change, didn't know what my role in that would be. I wasn't committed to running again. It's COVID-19 and the work that I did on the state's equity council in 2020 that ultimately gave me real practical experience in terms of how our government in Rhode Island operates, the lack of an equity lens that the previous and current administration have, and ultimately led to the question, what does that mean for the next 6 years? And so running this time, it wasn't about running against corrupt politicians or a patriarchal system, though that still very much exists. It is about transforming the Democratic Party in a way that ultimately represents more clearly the values of progress.
And this is going to be a competitive primary going into 2022. We obviously have Governor Dan McKee as the incumbent, so he'll have more of an advantage when it comes to fundraising and running on the record of opening up after the vaccination rates have gone up exponentially. And also now we have Secretary of State Nellie Gorbea who's running, and most likely we'll see Providence Mayor Jorge Elorza run, and General Treasurer Seth Magaziner, and there could be a couple more that end up running. And you had mentioned there was problems recently getting access to VAN and contacting the leadership of the party, and it just shows that and they had mentioned that they had one candidate recognized, which was Secretary of State Nellie Gorbea alongside Governor Dan McKee. With all that going on and the competitiveness of the primary, do you view your campaign as an underdog going into this primary versus these top elected officials in the state? And what differentiates you from them?
Yeah, I mean, anyone that is using sports terms would likely apply the underdog term to me. But really, what I would say is I'm an innovative rebel. You know, it's about time that we affect change, and I'm the candidate talking about what that programmatic change could look like. The other candidates, specifically Seth Magaziner, once he announces, which is likely this summer. Jorge Elorza likely in the fall or the summer, Nellie Gorbea and Dan McKee. Now, I think that they are going to operate in the way that they have previously, which is just trying to capture one issue, run with it, and say that when they get in office, they'll figure it out. And that's not what Rhode Islanders deserve, especially after COVID-19, where it was clear that a lack of a plan has negative consequences for our most vulnerable communities. I want to go back to what you referenced. You know, the Democratic Party, I reached out to them once I announced, and there was no reply. And not only the Democratic State Party in terms of the committee, you know, the state committee, but also there were some media institutions, really one or two that actually used language in a way that also reinforced this idea, which was not true, that Nellie was the first person to announce for the Democratic Party. Nellie Gorbea, Secretary of State Nellie Gorbea, to be respectful, had announced. And I consider that to be problematic if we are believers in an open democracy, right? And in fair elections and in all of the things that the Secretary of State and everyone else in the state has advocated for over time. So, or at least the Democratic Party has advocated for over time. So with that said, it is going to be a tough race, but what history has shown in the state of Rhode Island is that in crowded primaries, surprises happen. And I'm not interested in the idea, though it is possible, that a person with 40 to 50,000 votes wins, you know, because what that does is it just pretty much places us in a box of, well, we know that about at most, you know, or on average, 200,000 people may come out and vote, and therefore, if you get 50,000, you win. I don't think that's enough, though that is a possibility. You know, we have so many voters that have been disenfranchised over time here in the state of Rhode Island. We have very low turnout for our urban core communities that have the greatest need. And yet so little time is spent not only investing in those communities and the organizations that are supporting the communities, but in terms of empowering them to come out to vote, to know that there is a path to pragmatic change. Very little efforts expended. And I'm interested in, you know, I'd be interested in seeing if the other candidates are going to make an effort to inspire others to get out and vote. But I do know that it is a focus of my campaign to do that. And so victory as a possibility is very real. Again, in this crowded race where I also think that one or two more people will come out. So it'll likely be a 6 to 7 way split.
And now looking at some of the key issues you highlighted on your website's policy section, one of them is health equity. This is arguably an important issue amongst many Rhode Islanders that could be approached with multiple avenues. If elected, how would Governor Muñoz approach it?
Yeah, can you repeat the question one more time? Sorry, I just cut off a little.
No worries. One of the key policy issues on your campaign website is health equity. And this is arguably an important issue amongst many Rhode Islanders that could be approached with multiple avenues. If elected, how would Governor Muñoz approach it?
Yeah, thank you for the question. When we think about health equity, and we really focus on the data, which shows that there are poor health outcomes are disproportionately seen in communities of color and women of color in particular. And so the question is, like, how do we understand why we're seeing those poor health outcomes? And that ultimately branches back into everything else, right? All of these social determinants of health, the environmental conditions in which they're living. Do they live next to pollution generating industries? Do they have food access? Do they have housing? Do they have access to basic community health care to address mental health needs and other resources? And so it's all connected. And I will focus on healthcare for the moment in terms of systems, but I want everyone to understand that by addressing healthcare, that allows us to trace it back into every other issue that we need to address here in the state of Rhode Island, like low income and affordable housing. But to the healthcare point, we have seen over time two versions of a vision presented for the state of Rhode Island. We've seen the indifferent version, which is allow these large health insurance companies and large hospital systems to grow and grow with the hope that somehow or other they're going to do the right thing by Rhode Islanders. They're going to control costs and they're going to find creative ways of expanding access. That hasn't worked. And what's clear evidence as to why that hasn't worked is we have Blue Cross Blue Shield threatening to charge people for COVID-19 treatments in the middle of a pandemic. We have Blue Cross and Blue Shield lobbying against a reduction in co-payments for telemedicine in a time when we have mental health resource needs and people have been stuck at home. Even as everything's open up, people are still very much at home, right? I mean, there's some level of concern about just going back to normal for many communities, especially those that were negatively impacted by COVID-19 or lost loved ones. So as we, again, see, we cannot be indifferent to the health insurance abuse, pricing abuse, pharmaceutical pricing abuse, and large hospital system incompatibility with the needs that we have here in the state of Rhode Island. On the other hand, there have been visions presented for what would be a single payer system in Rhode Island. People that advocate for Medicare for all, I will say there's a federal argument for what Medicare for all would look like. That is different for when someone presents the idea of a state-run single payer system. I studied single payer systems, traveled to Japan, and experienced it firsthand, which is a different version, of course, than Israel, which is a very different version than Vermont's pilot, single payer trial over the last 10 years. So with that said, I want to kind of synthesize what I think is a first step towards even creating a version of a single payer system in Rhode Island that's sustainable. And it ultimately starts with the delivery system. Even if you cut out middle players that are contributing to the rising cost of drug products, drug prices, and services, even if you do that, even if you have the state administrate how those funds are distributed, right, on behalf of Rhode Islanders, we still are going to confront the reality that hospital systems, that the structures that are used to deliver care also are profit driven for the most part. And so how do we create a delivery system where the state has more of a role in providing free healthcare for all Rhode Islanders? And by doing so, puts itself at the table, right? Places the state at the table where negotiations around price capping for services and products are taking place. And the way to do that, I believe, is by having a completely free community health system, and certainly starting with a 5-county pilot, essentially having a version of this free community health system placed in each county in an area where there's more concentration of people, which is going to look very different from South County compared to Providence County. But still, we need to show that it works. And for anyone listening who believes that they are fiscally conservative and have concerns with what such a program would mean for spending, I would say we're already spending. $500 for an ER visit when you're not admitted is a lot of money compared to what you would spend in an urgent care center, as an example. But we also know that urgent care centers are private. And so if you don't have a congested, competitive urgent care center market, we're likely going to see abuses there as well. This is why a public version of a comprehensive community health clinic system will best serve Rhode Islanders. It reduces cost overall. It reduces the burden of healthcare costs, not only on our pockets, but also on the system as a whole, because unpaid debt also does weigh down on the whole system. And so anyone out there, again, that considers themselves fiscally conservative, I would say we can create a fiscally responsible, completely free and accessible community health system that serves as a foundation from which we can then build on into a single payer version that works for Rhode Island.
And you kind of touched upon towards the end of the answer a little bit of what I was going to ask as a follow-up when it comes to Medicare for all, because a lot of those who are fiscally conservative, their concern is that while there is the pledge to only tax people who make 400 grand or more a year to get the revenue, their concerns are that it doesn't seem mathematically possible, because how many people in Rhode Island actually make 400 grand or more a year? So just quickly, what would be your quick response to people who are concerned about the costs and potential tax increases that it would come with Medicare for all?
Yeah, so let me start with the taxation. I do believe that those making 475,000 or more a year should pay their fair share of taxes. I also believe that we should have categorical funds so that it's very clear where those revenues are going into. Pulling it into a general fund is problematic in Rhode Island, given that we've seen historically money ends up in the general fund and is misspent. So I want to put that up front. And in terms of how will we pay for this? How will it be sustainable? This really comes down to understanding where the biggest cost burden is in healthcare. If you look at other countries that have single payer systems, they're all very different and none are perfect. And many are finding themselves at a point where they're possibly heading down a path of not being sustainable. And the reason when you track that path, when you look at that trend, is because the cost per person, the healthcare expenditures per person are increasing because chronic diseases are increasing. We were seeing that with childhood diabetes in Israel, as an example. We are seeing that with obesity and metabolic syndrome in Japan. And so when we think about the US, if we're not talking about single payer, if we're talking more generally about Medicare for all and what that means for like across states, we have a high prevalence of chronic diseases like heart disease, diabetes. Those chronic diseases that you have to manage right on a daily, on a weekly, on a monthly basis have costs associated with them. And so unless we have community health infrastructure to make it more easily manageable, right? Like if you have a problem, you have a foot ulcer and you're diabetic, you have a clinic nearby that can manage that instead of being sent to an ER when things go bad because you waited 2 weeks because there was no clinic you could access. If we start to have stronger community health infrastructures, we have seen less clinics today than we saw in the 90s. Right. So why is that? We need to start rebuilding that community health infrastructure. On top of that, let's also talk about like how countries like Israel actually cap the pricing of drugs. They are more direct and forceful and aggressive in capitations around drug prices. We do that for generics, but at the end of the day, we have an entire specialty pharmaceutical industry where some drugs are costing $20,000 for one treatment. That's also problematic. And so if we don't tackle the products, the pricing, and the necessary capitations on those products, and also remove intermediary players from the negotiation table because they're charging us to negotiate, that's it. And in addition to that, set some reasonable controls around what the cost of services are. and standardize that. Unless we do that, then no system is going to be sustainable based on the chronic disease cost burden that we have in the country. And that is not a human burden. All humans deserve the right of healthcare, but it is a cost associated with it. And to make it sustainable, we need to remove these abusive industries from that table, right, from the decision-making process that's associated with the cost of products and services. So I hope that answers the question.
And just kind of like a quick recap, circling back to the taxation point of that question, would anybody making under 475K or more years see any tax increase whatsoever if elected governor and this were to be enacted into law?
Okay, so but now going back, so we're not talking about Medicare for all, we're talking about state-based single payer, and then the first version or phase of that being like community health infrastructure. So what I would like to see is, right now the proposal is to increase taxes on those that make 475,000 or more a year, about half of what it used to be, right? So it's bumping it up to, I believe, 8.99%. I think that's the bill. That's a proposal in the bill. I would prefer to go to 10.99 and to have a phase reduction. So we start high, and for 2 years, we make sure those funds are pulled into categorical funds. Those revenues are pulled into categorical funds. So we have an initial lump sum investment into these programs around healthcare, housing as an example, utility rate support, right, to address environmental justice as well, which is intimately tied to asthma rates when we look at pollutions anyway. So to do that, then it can go back down and reset to 8.99. And in that way, what we would do is we would lessen the likelihood or the risk associated with increasing taxes to others. And that's the way that I believe we can actually, again, have an initial investment, address the foundational needs while making the system during that time process sustainable, so that when we get less revenues in the subsequent 2 years, we're investing more so in process and operations rather than the infrastructure itself.
And while still on the health equity topic, before I go to the next key issue on your campaign's policy section of the website, one of them is that is a big issue when it comes to the term of health equity is reducing vaccine hesitancy. We do have, I believe it's 70% in Rhode Island that's vaccinated, but there are still plenty of people that are hesitant again the vaccine. Some people may not know how they can sign up and get it, while some people just may not trust it because of how quick it was made or whatever their reasons may be. Some people have legitimate health reasons why they won't get it. If elected governor, what would you be able to do to reduce the vaccine hesitancy for the COVID-19 vaccine?
Yeah. So a few things. I want to. There's layers to this. While the idea is that they're 70% vaccinated, I want everyone to know that the Department of Health is using census data from 2010, and that's problematic. The numbers we have for the amount of individuals represented in racialized communities like Black, Indigenous, Asian, Latino, as well as the unaccounted individuals who may not have the status of resident at this point in the United States, those numbers are likely higher. And so this 70%, which has been seen in a positive light when people talk about herd immunity, it may not be actually what we are actually seeing if we were using updated census data. Second to that, my concern is that those that have not yet received the vaccine have not received the vaccine because they are historically disenfranchised communities, because they are communities that have not been supported in ways that they should be, with not only multiple language digital materials, but with prints, with canvassing by the Department of Health, by the state government to make sure that they get out, with development of mobile clinics that would take place at night when they're not working the 1 to 2 jobs, right? And the reason I'm mentioning this is an ongoing effort I have in working with the National Guard. We are bringing clinics to what we call desert areas where there has been no vaccine, to the manors in Woonsocket that have largely been ignored by city officials, but also just the state as well. We want to reduce the equity gap. When I think about hesitancy, of course, there are people that are concerned, but that concern would happen even in a clinic if you were advising someone on blood pressure medication. There is no difference in consulting around a new medication and the potential side effects and consulting in the vaccine. It is a health literacy issue, and it is one that physicians, healthcare providers are trained to deal with. The hesitancy contribution to the equity gap is not a consequence. It's not a problem of people. It is a problem of not investing an adequate amount of resources on the state side into healthcare professionals that can go out and have community discussions, that can go out and participate as well in that canvassing. We have had millions of dollars unallocated because the state does not want to acknowledge that there is a problem. And that's not unique to Rhode Island. It is unique to many other states. So I'm saying all that. With that said, when we think about hesitancy, I would just challenge everyone listening to think about, well, what does hesitancy mean? Because there are layers to hesitancy. People not going to the Dunkin' Donuts Center could have easily been a result of their having a negative encounter with officials that carry weapons, and yet there were guns at the door. That might be a reason to hesitate. It could have been that they are working 2 of the 3 jobs and their employer does not let them go out and get the vaccine and will not give them a sick day if they don't feel well. And so they don't want to lose money when that money is going to pay for rent and food on their family's plate. Not everyone is hesitant because they believe that the vaccine will harm them. That is one layer of it, but it is not the only layer. And unless we start to invest more heavily in field operations, in getting out, knocking on doors, and having important discussions, unfortunately, I don't think we'll ever get a clear answer about the extent of any one of those layers of hesitancy. But my goal between now and the winter is to try as much as possible with the National Guard, with community leaders, to collectively inform, educate, consult, address concerns, and to give people an opportunity to get the vaccine if they want it. And not only adults, but children as well. Because we also know that if the gap exists with adults, then it is likely equal or larger with the children that are associated with those communities.
And you also stand for educational equity. That's another key issue on your website's policy section. There are a number of solutions that come up to achieve that goal in our state. 2 of them have mixed reactions that I've covered on the show before, and those are expansion of charter schools and school choice. Where do you stand on school choice and the expansion of charter schools in Rhode Island?
Yeah, so I'm going to give the long answer here. I believe that independent charter schools, when they were first developed, was really a movement of parents that wanted to demonstrate that there could be better quality education for their children, who again were largely in historically disenfranchised communities that were not being invested in sufficiently. And that is the motto of independent charter schools. Now, corporate charters are different. And in the name, it says it alone, right? I mean, what is it that drives corporate charters? Ultimately, it is, they may be driven by this potential need, but ultimately bringing a corporation into the picture. The question is, why are they expanding? What is the driving force around expansion? And is it largely to grow as a company, to grow a brand, to in some way, again, benefit, while not necessarily doing it for the core reasons, which is addressing equity, right? And trying to create a system that is void of, or does not have the same systemic racism inherent in it that the other education systems might still have in terms of structures. I do not believe that corporate charters are the future. I believe that we should be investing more heavily in our public school system. That argument regarding traditional public school systems and corporate charters, for me, is a matter of addressing the fundamentally racist education funding formula here in the state of Rhode Island. And so anyone that says that they want to place a moratorium on charter school expansion without simultaneously calling out the education funding formula here in the state as racist, what it is, as a funding formula that does not invest based on need, is not doing right by communities of color. And this is a conversation that needs to be had because there are parents of color who want the best for their children. They want an equitable outcome for their children as it relates to opportunity. And so when they hear politicians saying that they will close a door without opening up another, I can understand why that's problematic. But what I will say is the education funding formula is opening up, I believe, in either the end of this year or beginning of next year. And we need to start to have a debate about how that formula should change, how we should be investing based on need, which would mean that the urban core communities like Woonsocket, Pawtucket, Providence, Central Falls would get more. And in addition to that, how we can innovate around a statewide after-school program that has a specific budgetary line item in terms of expenditures that can bring students from across the state together, create a true melting pot across our towns and cities here in Rhode Island, while providing students, supplementing them with vocational and informal cultural learning that can empower them to create a legacy, right, in Rhode Island. Because what's happening here in the state is a continuation of what's happened throughout American history, a siloing of communities and ultimately division, right, that is manifesting in adults that find themselves in different political spectrums. So I think that an after-school program can really start to bring Rhode Islanders together, in addition with just, again, uprooting or changing this antiquated education formula that has left places like Providence in disarray.
So it kind of sounds like you're against the for-profit charter schools. Do I have that correct?
So yes, so corporate charter school expansion is not the future. I believe that we need to invest more heavily in public school education. With that said, anyone talking about a moratorium on charters and not talking about changing the inherently racist education funding formula we have in the state is not doing right by parents of color.
And when it comes to the funding formula, another part of that question, school choice ends up coming up where it would be allocated based on where the funding goes, based on where the students go, rather than just funding the systems entirely. And a student would not be able to be limited on their educational opportunities based on their zip code. So say come January 2023, you're elected governor, would a Governor Muñoz administration be for the school choice?
So that's a byproduct of the schools not being invested in and there being issues with the public school system. So I want to get to the root cause. I don't want to submit to the idea that we have to do patchwork or continue to submit to lottery systems, which are inherently racist. So my focus is on changing the antiquated education funding formula in a way that invests in proportion to need, while also expanding the resources that we are dedicating to after-school programs.
So more focus on the funding, more funding and the after-school programs, and not in favor of the school choice proposals?
More focus on getting money to the school systems that need resources so that families feel more comfortable in sending their kids to schools that are in walking distance.
And now focusing on to one of the controversial things that happened during the last governor's time as a governor was the tolling of the tractor trailer trucks, which is still sort of in pending legal battles, but you could start seeing the cameras coming up and the signs that say the tolls and how much the tolls are going to be. If elected governor, would you try to get rid of the tolls on trucks or keep them?
I would specifically try to make sure that there are protections against tolling resident vehicles, right? So Rhode Islanders should not have to pay tolls at any point in time to travel anywhere in the state. And to do that would be racist. To do that would, again, keep some communities that are economically disadvantaged, and that does include racialized communities, and it also includes communities that, again, are maybe white but are economically in places where they cannot afford those tolls. It would keep them out of certain parts of the state, and that's problematic. So my focus prior to this run and even now has always been, how do we protect everyday Rhode Islanders from abusive pricing across institutions? And this is just another area where I think we need to be very careful.
And you do mention a good point with the cars. There is concern that it could end up going to cars as well. Because say, for example, it's in this legal limbo right now, and the judge says, "Well, you can't just say only for trucks." The concern is that they'll say that the legislators will be like, "Oh, well, now that opens up the door for it to be cars as well." So it sounds like you're against extending it to any other vehicle like cars.
Correct.
And now, while we're still on controversial vehicle-related issues in our state, the car tax looks like it's finally being able to be phased out once and for all, where this budget, it was able to be implemented in it, and that could partially be due to the American Rescue Plan money. and next year will be the last year, and this will probably be something that the next governor will have to focus on a lot when it comes to the budget process. Because I remember, if I recall correctly, the last time, I believe it was Governor Kucheri, when we were close to phasing out the car tax, he said we couldn't afford it, and they kicked it right back in. If elected in January 2023, would you be for getting rid of the car tax once and for all?
Absolutely. And frankly, people who live in Providence, Central Falls, and Pawtucket are paying more than other towns and cities, right? So that I see that as problematic when you have communities, working communities, urban core communities, where there's a dependency on transportation, paying more in taxes, but in a way that's inequitable, and then also paying more for something like the property tax, but not necessarily seeing that translate into more money for the school system, right? So this is where it all gets interconnected. This is where we have to again go back and talking about what it means for those that are making $475,000 or more a year to pay their fair share of taxes. We should be addressing the car tax, phasing it completely out. We should also talk about the regressive tangible asset tax that micro businesses have to pay in the state. It is regressive. I mean, they're paying taxes on furniture that's older than 10 years old, and by really, like I said, being more ambitious and getting the first 2 years of a tax rate hike for those that are making $475,000 or more a year would give us funds to really, take the bold steps necessary to not only phase out the car tax, not only create categorical funds for healthcare, housing, but also to start addressing something like the regressive tangible asset tax, and to do it creatively through Commerce Rhode Island and through programs that are intentionally not only relieving right the burden of taxation on our very micro businesses, which are always forgotten in the state, but also simultaneously bridging those resources and programs with other opportunities like getting these businesses QuickBooks, things that would have supported their ability to get PPP loans, but many of the businesses on the south side of Providence did not have that basic infrastructure to even access those resources.
And there are a lot of issues that there are going to be covered in this gubernatorial election. And these next few, I just want to do kind of in like a lightning round style, because some of them are worthy of an interview of their own. So I'll just do these next couple in the lightning round. So like, quick couple word answers. Are you for or against legalizing marijuana in the state?
So I will say I can't give quick answers. It's not me. So I'll give like 1 sentence, 2 sentence answers.
That's fine. But
okay.
All right. So say, for example, you're elected governor.
Yeah.
Would you legalizing marijuana, pro or con?
So I'm for legalization with locally owned control and opportunities like cooperatives.
And are you for or against the line item veto power for the governor?
I'm for the line item veto power.
And should the governor and lieutenant governor run on the same ticket like how they do in Connecticut and Massachusetts?
In a state that sets up so many barriers for people from historically disenfranchised communities to run, I think that would be an additional barrier.
So against it?
So I wouldn't be running on a slate.
And are you for or against the opening of an inspector general's office in Rhode Island?
I mean, I like the idea of having a third party audit our systems. So for it, but with careful consideration of the costs associated with that as well over time.
And lastly, for the lightning round section, before we get to the non-political topics, should Rhode Island become a sanctuary state?
I mean, what do you mean by sanctuary state?
So in this context, there are a number of states like California where if you're undocumented, you have more protections similar to how it is in Providence right now. Providence is a sanctuary city, and there could be it could potentially Rhode Island could end up potentially being a sanctuary state.
Yeah. So I intentionally asked the question because I think that's Rhode Island. I'll be very specific. I think people who do not have the status of resident should be able to drive. I think that they should have access to assistance programs that are associated with health, housing, and food. I think that they are human beings and they should be treated with respect. And I believe that we should, both the Attorney General and the Governor of Rhode Island, establish executive orders that keep ICE out of publicly owned institutions and facilities, and ending contract with private prisons and ICE.
And now taking a step away from the political issues for these last two questions, you had mentioned earlier that you had attended Rhode Island College, and this is a question I usually like to ask to Rick alumni, since that's where I currently attend. What was your time like as a student at Rick?
I loved it. I loved it. Started as a philosophy major and in a small liberal arts school that leads to a lot of great, deep rabbit holes that you walk down when you're a philosophy major. But also, given that it wasn't a school completely focused on pipelines to medicine, the physical sciences department and all the professors there, Dr. Soman, Dr. Magyar, it was just amazing to see the amount of time that you could spend with them compared to a large school that has a 200 student lecture hall, right? So I'm very grateful for the education I received at Rick. I also had access to Rick only through the preparatory enrollment program, which is like a TD version at
The PEP program. Right?
Yeah, PEP. And otherwise, I wasn't a great high school student. I was it was my senior year when I actually decided to stay in school. I was on the brink of dropping out 11th grade. So I'm grateful to PEP. Back then it was directed by Joe Costa and Julia Nesbitt, and also grateful to the amazing professors that I had in philosophy and in the physical sciences.
Just transition to my final question. This is one that I ask everyone on the show to keep tradition, and that is, in your opinion, what do you think Rhode Island is best known for?
Rhode Island, I guess I don't know what other people are thinking, and I'm not gonna, I think when you look on the media articles, it's like tourism and food and culture, and that's all amazing. That is amazing. But for me, Rhode Island's like gravity, and I think why I'm always pulled into Rhode Island is that at its core, it is a mini nation. You go from one side of Providence to the other, from one side of Pawtucket to the other, one side of Woonsocket to the other. It is so different. The microcultures are so different. And while I know that in a hyperpolarized political era, that may seem scary, I actually think there's just an amazing opportunity when you live in Rhode Island to learn about so many different communities and to find ways of finding connection, right? To discover ways of finding connection. And having gone to Farmington, Connecticut, where I was in medical school, that was very different. You were in Farmington and you could walk for miles and you would still be in Farmington. And so it was very hard to get that feeling that you were, again, walking into a different cultural environment. So that's what Rhode Island for me is. It's just this amazing gem of cultures that have come together and created this mini nation that's in walking distance.
That's an interesting answer, and it's honestly true because I can attest to that. Like, I'm in the part of Providence where if I go like a minute that way, I'm in Cranston. If I go like another couple minutes that way, I'm in Johnson, and that is true. I can definitely attest to that. Dr. Muñoz, I want to thank you so much for coming on the show. It's been a pleasure of mine to have you on.
Thank you so much for the opportunity. I appreciate it.
And thank you once again for watching this episode of Ray-ality TV. If you want to see future episodes as soon as they're posted on this channel, please click the subscribe button down below, along with the post notification bell icon to the right of it.
Can I also share something? Sorry I know that was your like closing, but maybe you could do your closing again. But yeah, if you want to check out the campaign and learn more, governor2022.com. That'll direct you on to luisdanielmunoz.com. You can look at the platform. We also pull in articles and interviews. So this interview, when it's on YouTube, we'll pull it directly into the website as well. And direct it here. Obviously, we're not going to take the video. But if you want to follow me on Instagram, luisdanielmunoz.md. On Twitter, Luis Daniel Munoz. You can also hashtag Munoz for Governor. And on Facebook, our public page, Luis Daniel Munoz, MD. Please, if you are interested in supporting the campaign, reach out, ask questions. I'm ready to answer, and our team is ready to mobilize with you. So thank you so much for this opportunity again, and for giving me that quick 60 seconds of a pitch there.
No problem. And again, thank you for coming on the show. If just to recap that outro, if you want to see future episodes as soon as they're posted on the channel, please click the subscribe button down below, along with the post notification bell icon to the right of it. I'm Raymond Bakari, and I'll see you on the next episode.